Welcome to another CHRO Conversation, hosted by the Center for Executive Succession at the Darla Moore School of Business. I'm your host, Anthony Nyberg, and today we are speaking with former U.S. Congressman Rob Andrews, who is now the CEO of Health Transformation Alliance, a coalition of the nation's largest businesses who are working to transform the way that companies are providing health care for their employees. Rob, thank you very much for coming down here. We sincerely appreciate having you on campus.
I'm really happy to be here, and there's a feel here of enthusiasm and commitment that's infectious. I'm really happy to be here.
So we're going to be talking about healthcare, and I've spoken to you before a little bit about it, and you have an incredible knowledge and understanding of how we got to where we are and what's going on. But can you start with just talking a little bit about what do you see as the major challenges in our healthcare industry today?
The major challenge is that we pay people to do things they probably shouldn't do. Now, that's not because they're bad people or because they have poor intent. It's just that the incentive system in American healthcare basically pays hospitals and doctors and therapists on how many procedures they do, not how well you do them. I mean, I sometimes use the example that imagine if Uber paid their drivers on the basis of how many right turns they make in getting you from where you're picked up to where you want to go. You'd eventually get there, but the route would be circuitous and expensive. Maybe there should be more risk than there should be. That's a whimsical but accurate example of what goes on in American healthcare.
I think many people are frustrated by the healthcare system. Can you tell us a little bit how we got to this place of only taking right turns?
Yeah, it was a series of accidents. No one ever really sat down in the United States and thought about what a healthcare system ought to look like. In the 20th century, what happened is we had a lot of poor people stuffed into urban areas for the first time because of immigration. So there were public hospital systems created in a lot of the counties and cities of the United States. Much of it started with tuberculosis. There was a tuberculosis outbreak in the first third of the 20th century. So these hospitals were designed to help those people, and then they grew into more broad purpose hospitals. The second sort of accident that happened is in the Second World War, when the government imposed wage and price controls to keep inflation under control. Companies wanted to find ways to pay their people more money. And since that was illegal, what they chose to do instead was provide health benefits, and that sort of became the birth of modern health insurance. The third development was not by accident. It was very much an intentional decision. During the Johnson administration, the Great Society, Medicare and Medicaid were enacted to take care of people over 65, people with a severe disability, or people who were very, very poor. And then the final iteration of this was the Affordable Care Act in 2009-2010, which was designed to further plug those gaps. But the point is that unlike the interstate highway system, where planners sat down and thought through the idea of a spine of highways across the United States, that never happened here. The whole system just sort of evolved because of historical accident.
So when you're leading an organization, HTA, that seems to really be setting or opening new doors as to possibilities for how we might make this better. Can you share us a little bit about what that is, what that organization is?
We're 46 large American companies. We're Verizon and American Express and Marriott, Coca-Cola, International Paper. And what we have done is to take the $27 billion a year that our members spend on healthcare and try to coordinate that spending in a way that it encourages the top performers. You can almost think of us like fantasy football. That, you want to draft Tom Brady, not the backup quarterback for the Tampa Bay Buccaneers. And when someone's going to have a baby or has to have cancer care or whatnot, we want to do the equivalent of that. We want to figure out who it is that's most likely to make sure that baby is born in the most healthy way, or who it is that's most likely that could cure that person's cancer into remission. Which is not to say that there's easy ways to rank providers. It's complicated, but you can do it. So we're really all about trying to find the most effective care and pay for it in a way that incents people to provide it.
So is that going to resolve many of these big issues that you were just talking about? I mean, identifying who are the better providers, Does that really help us get at the costs?
It does, because often better providers make people healthier, which makes them cost less in the long run. Let me use diabetes as an example, type 2 diabetes. There are provider systems and there are doctors in this country that have really good track records at helping people manage their blood sugar and help them manage their diet and stay relatively healthy. Then there's some performers that are not so good. And I'd rather spend more on the top performer to teach somebody the best nutrition practices or the best weight control practices or the best diet, and then avoid a stroke or a heart attack or an amputation or blindness later on. So in some ways, some of what we're doing will cost more in the short run, but it's the long run that matters, and that's the premise of what we're doing.
So it sounds like it's a really interesting project that you're taking on, and the goals are certainly admirable, and we need it as a society. So what are some of the biggest challenges that you're facing in trying to get HTA to be as effective as they can be?
We're talking about a fifth of the U.S. economy here, healthcare. And so there's an enormous vested interest in keeping things the way they are. So whether it is benefits consultants or health insurance companies or hospital systems, they're doing pretty well for the most part under the present system. If you go in and you say, look, we want to shake up your business model. Instead of paying you X $1,000s a day to have someone in the ICU, we want your contribution, your compensation rather, to be based upon how good are you at keeping people out of the ICU? How many strokes or heart attacks did you avoid last year? Well, that understandably is a disruptive thought for people in the healthcare field. So like any other field, if we said to homeowners, home builders rather, instead of the homeowner paying you the full price for the house at the time of closing, we're going to pay you over 10 years to see how good the house turns out to be. Well, that would disrupt the real estate industry in a tremendously disruptive way, right? So I understand that people have legitimate motivations, but that's the cause of their resistance, that everybody wants change until it involves them.
So I've heard you talk passionately about the role that data analytics will play in working this and helping us move forward. Can you share with us a little bit about why you think that that's going to be a key?
You know, we have weather forecasters now that could tell you with fairly good degree of accuracy what the weather is going to be like 3 months from now in Columbia, South Carolina. They're not exactly right, but they're pretty accurate, and they're getting more and more and more accurate about predicting these things. It ought to be equally easy to predict who is most likely to develop diabetes or pneumonia or cholesterol problems in the next year or year and a half. And if you build a database that is sufficient to answer those questions, you apply the right analytics to it, you can figure it out. Not with 100% accuracy, but if you had 1,000 employees and the data would show that probably 90 of them are going to become diabetics in the next couple of years, it would be really helpful to know who those 90 people might be, not so you could target them or single them out, but you might intervene in a way that's ethically appropriate, respects their privacy, and kind of get there earlier in the game to figure out how to keep them healthier. So to us, the same analytics that are predicting the weather and forecasting who might buy a pair of shoes that you should advertise to could just as easily be used to prevent health problems from worsening or to find better methods of care for those who already have a health problem. Analytics, let's face it, is the realm of the present. It's every field is now understanding analytics better. Healthcare is way behind that curve, and we want to expedite and accelerate that.
And you're doing this as a consortium of private companies.
Yeah.
Is there a role for government in this? With your history?
Yeah, there is a role. The role has to jealously guard people's privacy and confidentiality, though. I don't think anybody should ever be at risk that very important medical facts about their family are out there in some public database. Can't have that. But there certainly is a role for government to help in what we call a de-identified way, which is where you can't tell who the person is whose record is in the file. But you could figure out that, women over 55 in rural zip codes and the bottom fifth of income who also have arthritis are more likely to have an amputation than someone who's not. I mean, like anything else, I'll put my data geek hat on here, that the larger the sample size, the smaller the standard deviation. The smaller the standard deviation, the more accurate the prediction. The more accurate the prediction, the more you know who you want to go help. So I really view this almost as a rescue mission that, yes, government could play an appropriate role in.
So where do you see HTA going? Does it become, do you get all the private companies into it eventually? Is it a model for how the world ought to work, or at least how the U.S. ought to work going forward?
We see the HTA as triggering a marketplace of competition where buyers of healthcare challenge providers of healthcare to compete with each other in a better way. Why can't people who are spending trillions of dollars on healthcare in this country, employers, employees, governments, say to hospitals and therapists and drug companies and others, get better, improve what you do, and you'll win if you do. So we see ourselves as a consortium of buyers that's going to challenge really talented, committed providers to do a better job than they do now.
So can it work? I mean, you described a number of challenges that over the years, over hundreds of years, have created the kind of the place where we are today, and a number of entities that have a lot at stake to keep things in the status quo. So what's going to ultimately push it over and make HTA successful in leading that market competition?
I would say to you that regulated, effective markets work. That when demanders spend their money in a way that is cohesive and well thought out, suppliers either respond or arise that meet those needs. Healthcare really isn't a market right now. It is a weird hybrid between a government payer program in Medicare and Medicaid, and then literally hundreds of thousands of payers in the private sector. I think that if you find a way to coordinate buyers, that Medicare continues to pay attention to what we call fee-for-value medicine, where they pay based upon the outcome of the procedure and not based upon how many procedures are done. And if companies then chime in on that, it begins to push the market in the right direction. And what we want to do, and what I think Medicare is moving in the direction of, is to say, if you are objectively better at something than your competition, you should do better than your competition financially. It's not a new idea. I mean, it works every day in automobiles and real estate and consumer goods. I know that they're a lot less complicated than healthcare, but I believe the same principle can work in healthcare.
So is there now a kind of a competition between the idea that you have laid out that private companies and the marketplace really drives this versus a single payer plan?
Very much so, yeah. Okay. Yeah, there is. I mean, single payer really is predicated on the notion that healthcare becomes a public utility, that the price for doing a C-section or an ankle operation is set by the government, and they pay it if you do if you meet their standards on it. Now, I guess there is a way that single payer could align with payment for quality as opposed to payment for procedure. And look, I served in the government. I'm not an anti-government person, but I will tell you that entrusting the job of the federal government delineating between effective and ineffective care is a very frightening proposition for me, because inevitably it'll be political. Government should play a role, but I think consumers and payers are better suited to determine what works and what doesn't.
Thank you very much for your time
today.
Thank you,
Anthony.
It's been super interesting for me, and I look forward to having you back down here again.
It's my pleasure. Thank you.
You just listened to another CHRO Conversation. Today, Rob Andrews shared his views regarding how organizations can transform the healthcare industry through the billions of dollars that are spent on healthcare through HTA's members. On behalf of all of us who are associated with the Master of Human Resources program and the Center for Executive Succession here at the University of South Carolina, thank you for joining us.